Step 15, embryo transfer. Before your IVF treatment cycle, your specialist makes plan in terms of embryo transfer. They decide two things mainly: the timing of your embryo transfer and also whether they will expect any difficulties and how they will mitigate those difficulties. In terms of timing, so they decide whether you will need to have a fresh embryo transfer or freeze all your embryos and transfer embryos in the future. In terms of fresh embryo transfer, that means you have ovarian stimulation, egg collection, creation of embryos, and one of the embryos will be frozen and additional high-grade embryos will be one of the embryos will be transferred, then additional high-grade embryos will be frozen. So, and in terms of freeze all cycle, you create the embryos, then on day 5 and day 6 after egg collection, you freeze all the embryos and do transfer in the future. Now we will explain why you may need to do freeze all. So there are 3 different reasons: elective freeze all, in-cycle planned freeze all, and emergency freeze all. In terms of elective freeze all, in some clinics that's standard practice that they always do freeze all and transfer embryos in the future. So, and also it may be due to embryo banking. You may need to bank your embryos for medical, social, or professional reasons first, then transfer embryos in the future. And third is due to some pathologies like hydrosalpinx, uterine fibroids, uterine polyp, uterine septum. If you have these pathologies, you may actually do IVF and collect the embryos, bank up the embryos, then sort out those problems and transfer embryos in the future. And also, you may need to plan freeze all during the cycle. So due to undiagnosed pathologies that become apparent during ultrasound scans during IVF treatment cycle, then in this case you just decide that you need to freeze all the embryos, then sort out those problems, then do embryo transfer in the future. And also if you're at risk of OHSS, typically we give the decapeptyl trigger or agonist trigger and freeze all the embryos so that you won't have a risk of OHSS if you get pregnant in that cycle, then transfer embryos in the future. So, and also sometimes we need to do emergency freeze all. That happens usually if there's a failed attempt to transfer. So you try to transfer embryo, you can't reach endometrial cavity or uterine cavity. In this case, you freeze all the embryos, then sort out the problem, then come back and transfer in the future. Also, your specialist look through your notes and find out if you have if they expect any difficulties. So difficulties you may face due to pathologies like if you had a previous failed embryo transfers, history of loop excision which can cause a narrowing of the cervix, and history of cervical stenosis and anatomic variation. So if you're diagnosed with, let us say, acutely retroverted uterus, for example, if you have a different variation in the anatomy of the cervix and uterus, your specialist may be able to predict that before your IVF cycle and take necessary precautions. So in terms of planning is of course ultrasound guided transfer is best strategy, because on ultrasound you can directly see the anatomy of the uterus, anatomy of the cervix, and you can actually see your catheter going through the cervix, and you can direct the catheter which should follow the anatomy of the cervix. And also, you can plan different strategies beforehand, like using special stellate, malleable stellate, where you can change the shape of this your catheter according to the anatomy of the cervix. For example, if you have S-shaped cervix, some catheters you can change the contour so that it will match with your cervical anatomy. Then you have to discuss with some patients that if they need to do this procedure under general anesthetic. For example, if they have a history of severe anxiety, vaginismus, they may need to do the procedure under general anesthetic. Generally, embryo transfer is very simple, straightforward, safe procedure. Very rarely patients need general anesthetic, but in some patients this may be right decision, right option. So, and also you should have a strategy in place if you face difficulties that you can do freeze all and then organize hysteroscopy procedure in the future. So yeah, so it's essentially by planning timing of the embryo transfer and anticipating difficulty of the transfer, then your specialist in yourself you will know what will be best strategy, and so that you have as little stress as possible during IVF treatment.